Well, welcome back to class, everybody. This is the first little mini lecture video for Module 2, Part B. So I hope that you are navigating the classroom just fine. I've heard from many of you and have had some good questions, but overall it kind of seems like most of you are finding your way pretty easily through the class. And believe it or not, we are over halfway now done. We're just past midterm in this first summer session class. Things always go by fast in summer school, but you're doing great. So great work overall. Graded your quizzes, great work. I graded your textbook review or your TV show review, and excellent work. So hope you're doing good. Hope that you're learning a little bit. Hope you're enjoying the class. And just a real quick word of announcement before we talk a little bit about relaxation training. Just be aware that Tuesday, June the 23rd is an important day because it is kind of the wrap up of this second module. And at noon on that day, at noon on the 23rd, Tuesday, your case study, your behavior theory case study is due in the Dropbox, so don't forget about that. And that's also too at noon on that Tuesday, the 23rd. That is when quiz number 2 opens. So I have posted for you a study outline and a study guide just like last time. The format of this quiz number 2 will be very similar, if not identical, different questions, but same type of questions as was on quiz number 1. I know we just took quiz number 1, but it's time for us to take quiz number 2. So on Tuesday, noon on Tuesday the 23rd until noon on the 25th, that quiz is open for you to take as we wrap up module number 2. And what we're talking about in module number 2 is we're talking about just some basic examples of ways that we see the concepts of behavior theory at play in the field of social services, counseling, social work, whatever it may be, working with people and their problems, families, kids, parents, mental health counseling, addictions counseling, whatever it may be. And so there's really a lot we could talk about. And so for the sake of time though, like I do in most of my classes, I'm keeping it pretty basic. And so we talked last week about some core ideas: modeling, shaping, extinction, and token economies. There are several more things we could talk about. We could talk about rehearsal. We could talk about response cost. We could talk about point and level systems. There's a bunch of other stuff we could have talked about in that section, but we just kind of kept it basic with those 4. And now this week, for this second part of this module, I want to talk to you about 4 more things. These, again, are 4 more applications of where we see behavior therapy or behavior theory at work. We want to talk about relaxation training, systematic desensitization, in vivo desensitization, and flooding. So before we do that, a little bit of an intro. I don't know if you saw this on the news. This kind of stuff catches my attention because my background is counseling. I really am kind of a counselor who teaches at a community college, and maybe you saw the story that was published this last weekend, which was done by a large university in the Chicago, Illinois area, I believe. And the study basically showed that currently right now in the United States, the rates of anxiety and depression are the highest they have been in almost 30 years. And that probably doesn't surprise us, considering what all's going on in our world right now. The global pandemic and all of the disruptions from our normal routines that have happened, the job losses, the financial concerns, the stress over children and education, the stress that you have experienced and I have experienced as our college classes have been disrupted. All of the stress, all of the anxiety, and then all of the social issues and the issue around racial equality and social injustice that we see now at the forefront again in our society. And how, while there are many good things that will and hopefully will come out of that, that is a stressful situation on all levels where people are worried or concerned or frustrated or whatever it may be. And then the economic situation, all kinds of situations in our world today where we see anxiety and depression. People are struggling. In case you're not aware of that, I don't mean that to be negative or pessimistic, but we just kind of live in a world today where people are struggling in many different ways, many different levels. That's probably no surprise to you. The area of anxiety is, if you work in social services, is one of those areas that you are going to become very familiar in working with, no matter what kind of work you do. Whether you work with kids, adults, older people, addictions counseling, mental health counseling, working with parents, working in schools, whatever it may be. Depression and anxiety, which we talk a lot more about in the abnormal behavior class. Some of you have been in there with me already, or maybe you'll be with me in there this fall. Those two primary mental health struggles that are separate from each other but are often interwoven with each other are just so common in our world today. And we deal and see the effects of depression and anxiety in all kinds of ways in our world. And you may be wondering, well, why are we mentioning depression and anxiety in this class? Well, one of the reasons why is because anxiety specifically, I'm going to separate it from depression for a second. Anxiety is really, and struggles with anxiety, are really the number one reason why people, number one, seek medication. Most medicines today given by psychiatrists are not for depression, it's for anxiety. So anxiety is one of the number one presenting problems to medical doctors, physical doctors, heart doctors, and those who deal with not more psychological but more medical problems will tell you that many of the medical problems they see in their offices every day are related to anxiety. People have sleep disturbance and sleep problems. People have gastrointestinal issues. People have ulcers. People have all kinds of physical issues because of stress and worry and anxiety. And if you do counseling, again, it doesn't matter what kind of counseling you do. I don't know if I've ever counseled anyone where we didn't at some level have a conversation about that person's struggle with worry or fear, being afraid of something, being worried about something for the future, uncertainty, lack of control, loss of control. Worry and stress and anxiety is just a common experience in our world today. And so there are a number of different ways. Let's talk about treatment for a little bit. There's a lot we could say about anxiety. But I want to talk about treatment for a little bit, because that's kind of where you and I come in. Hopefully as students, you're hoping to one day work in the field where you're working with people to help them to improve their lives and to come up with solutions to do something different so their lives are better. So let's talk about treatment for a little bit. So treatment is just this idea of, well, what can we do? What do we do? What do we know works for people who struggle with stress or worry or fear or phobias or PTSD, kind of post-traumatic kinds of symptoms? Well, what can we do for folks? Well, like most things, there's a lot of different ways that we know we can and we do treat people and help people who have anxiety issues. Number one, many people who have anxiety struggles can and are at times on medication. If the anxiety and the stress and the worry is intense enough where it disrupts their lives or their sleep or whatever it may be, sometimes they're on medications. We know there are medications that can help people to feel less anxious and feel more calm and in control, that kind of thing. So there's that. We know that's a treatment option. We know that counseling is oftentimes an option as well too. And when it comes to counseling, there's really a couple of different ways to help people with anxiety. One are the more what we call insight-oriented approaches. And again, for those of you who are going to go on and get your bachelor's degree or your master's degree, especially in counseling or social work, you'll learn a lot more about this idea that all these different theories, some of them are what we call insight-oriented approaches. An insight-oriented approach would be like Freud's psychoanalytic theory, or CBT, which we're going to talk about next module, or Carl Rogers' person-centered theory. Insight-oriented means you're challenging the client to look inside themselves. That's what the word insight means. Insight-oriented means asking people to think about or talking through with them their struggle and getting them to think about what they're feeling and the decisions that they're making and how the world around them is influencing them, hopefully as a way to help them to understand themselves better, to understand their emotions better, make different choices, that kind of thing. So a lot of the counseling that we do with people who struggle with depression and anxiety are more what we call insight-oriented approaches. And those are often very helpful and effective, especially the next module we're going to talk about cognitive behavior theory. That's one of my go-to approaches when I work in mental health counseling is CBT. Not effective for everybody, but it's a common go-to approach for us as helpers. So these insight-oriented approaches are an option for people who struggle with anxiety. But then there are what are called the behavioral approaches. That's what this class is about. We also too, and part of why I want to talk to you a little bit about anxiety before we talk about relaxation training, is because in the area of anxiety, the area of working with people who struggle with anxiety, we find and have found through the years that a lot of what we call behavioral, I'll use my air quotes here, behavioral approaches are also very effective, and we use them a lot. And so I always talk about anxiety a little bit in this class, because what we're going to talk about in this quick little module here, the second part of module 2, is I want to give you 4 examples of what we call behavioral approaches. They're not insight-oriented approaches. They're more what we call behavioral approaches that we often use with people and in situations where people are struggling with anxiety or stress or worry or fear or whatever it may be. So just real quickly, well, last couple of words here. Number 1, I always tell the abnormal behavior class, just keep this in mind. Anxiety is something that all of us experience. And it's connected to stress. So if you look in the lecture notes, I've given you some lecture notes this week, and some of you have heard this conversation because you've been with me in another class. And one of the ways I look at anxiety is this pattern of stress, worry, anxiety. Stress, then worry, then anxiety. And we oftentimes use those words together, but really, stress is kind of where anxiety starts. Stress is just pressure. It's the pressure that you and I feel because we live in a world where the world pushes in and presses in on us. In my opinion, in my experience, that a lot of the stress we experience in our lives is directly connected to the idea that all of us naturally want to feel a sense of control of ourselves and our world. But we live in a world where we have limited control. We need control, but we don't always have control. That's where stress comes from. Stress comes from situations that I don't know what's going to happen next. I've got people pulling me in all kinds of different directions. I'm under the gun to get something done. I'm tired physically. I'm not feeling well physically. I'm a little under the weather. So stress comes in. So all of us experience stress. Stress leads to worry. Worry is the cognitive part. It's where we start thinking and wrestling in our mind with, what can I do about this? How can I fix this? What can I do? It's the cognitive part. And oftentimes, if we're not careful, our worrying leads then to the emotional experience, anxiety. I always say worry is in the head and anxiety is in the heart, because worry is more cognitive. It's wrestling with something. Anxiety is more emotion. Now it's complicated, right? But anxiety is more, kind of the result of worry. Me not being able to figure out what I want to do or whatever in my mind. And so that's the worry. And oftentimes, if we're not careful, it leads to anxiety. So all of us know what worry and stress and anxiety is. Not all of us deal with it the same way. Not all of us struggle with it the same way. But a lot of what we're going to talk about in this section are the kinds of things that probably any of us could apply to our lives, but especially we see used in the counseling field today. 2 weeks ago, this coming Friday, I was sitting in a CEU, Continuing Education Unit webinar. I'm attending a virtual learning class, seminar, professional seminar. And the presenter was a psychologist down in Houston, works down in South Houston. And he was talking about, interestingly, the effects of the current pandemic on couples, relationships, families, more on like an emotional, psychological level. And very quickly, he hadn't been talking 10 minutes before he was talking about anxiety and stress and all the concern and all the worry. He says, I see that in my practice today. I always see it, but in the last month or so, it's just kind of increased. And he was talking about anxiety and stress. And pretty quickly, I noticed, I made a mental note when he said, because he shifted the conversation to treatment. So here's kind of just some reminders. And he was talking to just a group of professionals, and it was more like a reminder conversation, right? Where he said, here's just some reminders. Here's some things that I do. And very quickly, the first thing he said was relaxation training. And the comment he made was something to the effect of this. He said, one of the things I fall back on all the time is I fall back on those old school relaxation training techniques that many of us learned years ago. And I kind of made a mental note because I knew we were going to be talking about relaxation training in this little section. So just real quickly, I want to give you this first idea. It's called relaxation training. This is an example of what we would call a behavioral approach, or some behavioral approaches, not insight oriented, that really are often used today. Just like this gentleman, this psychologist right here in our area, he gave testimony. Hey, here's an example of what I do all the time with my clients is I use a lot of relaxation techniques or relaxation training. Relaxation training is a very broad term, and underneath it could be a bunch of different things. Some of you may be familiar with yoga or meditation, those kinds of things, or whatever it may be. There's some similarities to those kinds of things to relaxation training. Relaxation training is really any approach that we use where we are intentionally relaxing our body or our mind as a way to soothe our emotions. That's what relaxation training is. There are a lot of different approaches underneath the heading of relaxation training. And you may not think that these are like traditional counseling interventions, and they kind of in a way are not, because they're not the traditional talk therapy kinds of things, but we use them all the time. And relaxation training is a really simple example of a behavioral approach that we use when we work with people in counseling and social work when they're dealing with anxiety. We also see it a lot in addictions and mental health counseling as well too. So we could have an entire module, an entire class just on relaxation training, because there's a bunch of different examples. But I want to just highlight, I always highlight three real basics for you. Let me review them for you real quickly here out loud. You'll see them mentioned again on the PowerPoint. You'll see them mentioned again in the lecture notes. So number one, the most kind of the bottom line ground floor kind of relaxation training technique is deep breathing. So there are a number of different deep breathing activities, exercises, and techniques that you and I can learn as individuals, or we can teach to our clients. I give you in the lecture notes this week a handout on one of those. There's many on one. This was the one that I was taught many years ago when I was doing my clinical work and I was a clinical intern. It's called box breathing. And box breathing is just one. I've given you a handout for you to look at. It's just one really simple example of a deep breathing technique that we can use with ourselves, or we can teach to our clients when they are finding themselves anxious or stressed or worried or whatever it may be. All the deep breathing activities basically are this, no matter which one you use, whether it's box breathing or something else. Bottom line is, what we do is we intentionally slow our breathing rate down, because when we are stressed, without even realizing it, our fight or flight, kind of a system kind of kicks in. And if we're stressing and worrying over something, our heart rate picks up, our breathing picks up, our muscles are more tense. It just naturally happens. And what happens when we're worried and stressed is that just increases. It just adds to our worry and our stress. So one of the ways that we can learn to manage and self-manage our own anxiety is to learn how to intentionally slow our breathing down. And by slowing our breathing down, here's what we're doing. Number one, we're expanding the lungs. Big old muscle in our body below our lungs, the diaphragm. We're expanding our lungs. Instead of shallow breaths, we sort of expand the lungs with more deeper breaths, bring in good, clean air, right? And then blow out that old air out of our lungs. And what we do is we expand out our chest muscles in our lungs. We expand out that diaphragm. One of the biggest muscles in the body is that diaphragm beneath our lungs. And what happens when we do that and we expand out is we loosen that diaphragm muscle, and what that means is it needs less blood because it's not tight. So the heart works less. The heart naturally begins to slow down because we're slowing our breathing down. Our respiration, our breathing, and our heart rate are directly connected to each other, right? And so there's this idea of intentionally slowing down our breathing as a way to slow down our heart rate. And what naturally happens then, when that happens naturally, is when we slow down our heart rate and slow down our breathing, it's easier for us to slow our thinking down, and we naturally just feel more calm. There's something about that just sort of naturally helps us to be more calm. So like an example of box breathing is this. I'm gonna use my hand here as an example of that. Box breathing, it was the first approach that I was ever introduced to as a counselor many years ago. I still draw from it sometimes even today. And box breathing is this idea, there's this idea of a box, right? And what you would do is either, if you were teaching it to someone else, is you would say, what I want you to do is I want you to kind of relax. Now again, here's the thing with box breathing, with any breathing technique. If you're teaching it to someone or if you're using it on yourself, You don't want to hyperventilate, so you don't want to go really fast. You also don't want to go too slow because you'll pass out. You don't want that either, right? So with box breathing, what you do is you say to someone, what I want you to do is I want you to inhale real deeply, and I'm going to count to 3. I want you to hold then the air in your lungs for 3. So it's inhale 2, 3, hold 2, 3, exhale 2, 3, rest 2, 3. So let me do that again. So it's inhale 2, 3, rest, or hold it 2, 3, exhale 2, 3, rest 2, 3. And usually when I've used this before, I do that with a client to give them that visual of a box. In, hold it, inhale 2, 3, hold it 2, 3, exhale through your mouth 2, 3, rest 2, 3. And you just teach folks to do that. And again, you want to keep it consistent. You don't want to go too fast because people will hyperventilate. You also don't want to go too slow because people will pass out. It's just real consistent. And you sort of teach people, and they can visualize that in their mind. They can close their eyes. They're inhaling, holding that, and they hold it for 3 seconds. They let it go, and then they rest. And that is just a really simple, we call that a self-management technique. Self-management technique is where I, as the client, learn a skill I can take away from the counselor or whoever I'm talking to, and then I can practice it and do it. I don't need anyone around to show me how to do it. I do it, right? So it's a skill that we kind of learn. So deep breathing activities or deep breathing exercises are like the most foundational example of relaxation training. Really, really simple. Let me mention 2 more to you that maybe you've heard of, maybe you've not heard of before too. Second one is what we call grounding or mindful meditation. Now, meditation is something you probably have heard of. And we use a lot of that in counseling today especially. I was in a seminar not long ago talking to a woman, listening to a woman. She was sharing. She works also in the Houston area, and she works with veterans with trauma and PTSD kinds of symptoms. That's kind of her area of expertise now. And she spoke for about 3 hours on the issue of post-traumatic stress and the issue of substance abuse and the co-occurring disorder of PTSD and addiction and substance use disorders. She had a lot of conversation about that. And then towards the end of the presentation, she talked a lot about how she uses mindful meditation, and she uses it as a skill she teaches with her clients who have all this anxiety and all these PTSD. Mindful meditation is essentially where you're working with clients to essentially clear their mind. Because when we're worried and we're stressed, our mind is going 90 miles an hour in 42 different directions. And all it does is just feeds our stress. It makes it worse. It's like a snowball. So one of the ways people can learn to self-manage their stress is, number 1, taking control of their breathing. You can also, too, combine that with mindful meditation. Mindful meditation, it is what it says it is. It's where you'd have someone close their eyes, and you would go through a process, or you would teach them a process where they essentially clear their mind. And you do your best, and the person does their best to let go of certain thoughts and to try to just kind of clear out the trash and just focus on just one thing. That's what the word grounding means. Grounding is, again, a lot of times with anxiety, this is kind of what we look at. A lot of times with anxiety, people are either over-focused on yesterday or tomorrow. Something didn't happen yesterday, something happened last year, something happened years ago, something happened last week, something that bothered me. We get over-focused on yesterday. Or we get over-focused on tomorrow. What am I going to do? What am I going to do? What am I going to do, right? A lot of anxiety in our mind, we're over-focused on yesterday or the past or tomorrow or the future. And what we found is that people can kind of let go and just get focused more on today and the here and now. What is going on right now? Where am I right now? How am I feeling right now? More what we call a grounding approach or a grounding technique. And people grounded in the present oftentimes is a way for people to let go, try to let go to at least temporarily of whatever you were stressing over didn't happen yesterday, or something that happened yesterday, something that someone said or whatever. You're not sure what's going on later. You know what? Let go of all that. Let's just think about right now. And we can use meditation, mindful meditation, to get people focused on the here and the now as a way to kind of distract, kind of clear out the trash of our mind oftentimes. So meditation has been around for thousands of years, and meditation can be used in 100 different ways, sort of like breathing techniques can be used in a ton of different ways. meditation is another thing that we use often in counseling to help people to get kind of focused and refocused in their mind. Again, what we're kind of fighting against is our mind going crazy and going a bunch of different directions, kind of being more focused in on where we are, on the present moment, letting go and clearing out, slowing things down a little bit cognitively. That's what meditation is good for. A lot of times we use mindful meditation and deep breathing together. We oftentimes pair those together. That would be another second example, mindful meditation. And then there's guided imagery. And again, I remember as a clinical intern many, many years ago when I was completing my master's degree in counseling, I did my practicum in a counseling center. And I was introduced to a lady. I was very blessed because I actually was hired to work there. Once I graduated, they offered me a job, and this lady became my coworker. But I remember being a grad student, brand new. I didn't know anything about counseling or whatever. And I remember being introduced, like in my first couple of weeks, to something I had never heard of before called guided imagery, because this lady worked her area of specialization. She was an LPC. Her area of specialization was working with women who had experienced sexual abuse or sexual trauma. That was her area of expertise. That was her clientele were primarily women who had been sexually abused or sexually assaulted. And I remember talking to her one day and her introducing me to this idea of what's called guided imagery. And she said, I use a lot of guided, you know what guided imagery is? And I said, I have no idea what that is. So guided imagery is like meditation. Basically, you have the person first clear their mind out completely. That's meditation. And she said, then I use guided imagery. It's where you're cognitively asking people then to pull up into their memory, usually positive, soothing images, to where in their mind, they kind of go somewhere in their mind. They're still seated right here in my office, but instead of worrying over what I have people do, she said, what I have my clients do a lot of times is I have them close their eyes and get their mind clear, like through a meditation exercise. And then I have them picture in their mind someone in their life who has helped them, someone in their life who they trust. And I have them just pull that image up of that person as a way to encourage them. Sometimes I have them, she said, a lot of times I remember this lady, her name was Emily. She said, a lot of my clients have all of this, they don't feel secure in themselves. They don't feel confident. And she said, a lot of times, one of the things I'll use guided imagery to help them build confidence. I'll have them imagine in their mind, seeing themselves, confronting that boss who I know I need to say something to, but I don't. I need to confront that partner, or I need to do whatever it may be. And she says, sometimes I'll have them visualize in their mind doing that and seeing themselves doing it and being successful and seeing themselves doing it confidently. Sometimes we use guided imagery as a way to bring closure to situations. A lot of counselors will use guided imagery when maybe someone close to them passed away and they never got to say goodbye. I wish I could go back and could say this to my dad or to my mother or to my brother. I never had a chance to tell them I was sorry. I never had a chance to tell them that I loved them. A lot of counselors will use guided imagery. It's just a powerful cognitive, tool to where people can close their eyes and they're not literally doing it, obviously, but in their mind, they're able to say something, to do something, to follow through on something. You've heard this phrase, go to your happy place. That's sort of a guided imagery kind of thing. Because sometimes what people will do if they're really stressed especially is that therapists or counselors can teach, or someone can learn themselves, at the end of the day when I'm really feeling overwhelmed, or middle of the day when I'm really feeling overwhelmed, what I do is I close my eyes and I imagine a place that is comforting to me. Maybe it is somewhere I like to go on vacation. Maybe it's somewhere like a beach. Maybe it's somewhere like the mountains. Maybe it's somewhere that to me, maybe it's my old home that I grew up in, or whatever it may be, right? Just a place that to me is comforting and it represents security and safety. And I kind of can go there in my mind as a way to kind of calm myself, to kind of ground myself, and to kind of center myself. So guided imagery is kind of like meditation in the sense that it is a cognitive process. But with meditation, we're kind of clearing the mind. With guided imagery, we're intentionally directing the mind. It's kind of the way I see them, although meditation can also be like that. meditation is more kind of clearing the clutter out. Guided imagery is more intentionally focusing my attention on certain kinds of things. A lot of overlap between guided imagery and meditation, but those are sort of the way those two things are a little bit different. Those are just 3 examples of what we call relaxation training techniques. There's a bunch more than just those 3, but those are all examples that we call behavioral approaches. We're not sort of processing through, talking through all people's anxieties or hurts or worries. Really, what we're doing is we're just sort of teaching people ways that they can behaviorally take direct control, intentional control of themselves, their thoughts, their breathing, their mind, where their focus in their attention is. Relaxing the body as a way to relax the mind, or relaxing the mind as a way to relax the body, as a way to relax the heart, as a way to relax the emotions, right? So that's why they're all examples of what we would call behavioral approaches. So this is one example, the relaxation training techniques. Real simple, but I like to cover them because we use them so much. And my hunch is many of you probably have either tried them or you've heard of them. If you've not, and you're going to work in this field, you'll realize when you get in the field how much we oftentimes as helpers use these kinds of techniques to help our clients, in addition to some of the other things that we do as well too. So in the next little mini video, we're going to talk about exposure therapies, but this is just an intro to anxiety and into the relaxation training approaches. All right, see you next time.